anytime you interact with the public, you need to wear a mask at all times. So it's just very hard for me because I'm a very, very friendly person.
I have a residual cough, so I felt guilty even coughing in front of my partner, thinking that maybe I might give it to him.
It's like question mark all the time about what's gonna happen.
To police in the middle of a pandemic is a very new thing for me.
Definitely went back to work earlier than maybe I should have. I know it's a dire time out there, and not only the city needs me, but my coworkers do. There's still a fear that since I am around patients that have been exposed, that are possibly COVID-19 positive, that I could get it again. And is my body ready for round 2?
When I came into the station the first day I got back, everybody they were like hugging me. Actually, people feel like, hey, you have the antibody. Like you're the cure. They make jokes like, oh, you don't even need a mask. You're good. You fought it. I don't like it because I feel like people already have this stigma about police officers, like we're robots. And so with the mask on, I feel like people can't really see your face, but it's something that I feel like we have to do because this is serious, you know. I thought it was a game too. It's real. It is real.
We believe that we got it from either 3 suspected inmates that were having symptoms of the virus. There is no way to keep social distancing all the time between inmates. So eventually, if one gets sick, it's gonna spread really fast and it's gonna get everybody sick. It's a lot of stigma about this virus because of the unknown.
I wanted our officers to understand that, especially that they had to take even more precautions, is that this wasn't one of those abstract concepts that's happening to someone else. This is happening to their chief and their mayor and one of their commanders. You know, we understand responding to serious incidents. I mean, we had a mass shooting in our city a year ago. We know how to respond to those events. That's what we're trained for. This is very different. I told my officers, all right, guys, I have no idea what is going on, but we're going to figure it out together.
It's just the luck of the draw. And that was the scariest thing for me returning back to work. I'm like, I don't want to get sick again, but it's like, this is my job. So I have to.
Being on the front line doesn't really bother me too much. I'm just a little more cautious.
You never, for once, really think about yourself as the patient. It gives you a little bit more empathy for your patients because you've been there.
There are people that rise up in the middle of crisis, and we, law enforcement, all first responders and medical professionals, are so resilient. And in times like these, you know, we can bend, but we absolutely cannot break.